Welcome to the Get to the Root podcast, where we build your health from the ground up. At Root Functional Medicine, we're on a mission to bring sustainable and validated functional medicine to the world. As a team of doctors and dietitians, we are dedicated to treating gut health, hormones, autoimmune conditions, and metabolic health at the root cause through advanced testing, food as medicine, and telehealth programs. For years, we've been helping people get to the root of their health concerns. Now, we're here to share our knowledge so you can benefit too. Stay tuned and join us as we get to the root.
Welcome to Get to the Root, the podcast where we uncover the deeper causes of chronic health issues and explore how functional medicine is transforming the way we approach wellness. I'm your host, Erica Armstrong, and today we're diving into a conversation about the future of employee health and the role functional medicine can play in workplace wellness. Today we have a truly inspiring guest with us, Max Rispler from Hylant. Max is a seasoned expert in the insurance and employee benefits space, working with middle market employers to uncover innovative and impactful ways to add value to their employees while keeping costs in check. But what makes Max's story even more compelling is his personal health journey, which ignited a deep passion for functional medicine. He brings a unique and holistic perspective on why healthy living is crucial not just for individuals, but for businesses striving to better care for their teams. In this episode, we'll dive into the often overlooked gaps in employer-sponsored healthcare, explore why traditional models fall short in addressing root causes, and discover how functional medicine is revolutionizing workplace wellness. So get ready for an enlightening conversation that could transform the way you think about health and wellness in the workplace. Let's jump right in. Welcome, Max. Can you please share with the audience a bit about your background and how you got into the industry?
Yeah, awesome. Thank you, Erica. And I really want to first off say thanks for having me on your podcast. Really appreciate it and everything that you're doing in the functional medicine space. So very excited to kind of talk a little bit more about what I'm seeing in the healthcare space. But my background's very unique because I actually so my parents were more on the provider side. And growing up, I got to see a lot more from patient care and the provider. So my dad was an orthopedic doctor. He also ran the orthopedic residency program at St. Mary's for 12 years. And then my mom was a RN. She was a travel nurse in the emergency room. So I got to see a lot of different things from a background perspective growing up, being close to them and understanding the inner workings of the healthcare system from the provider side. So that kind of parlayed a little bit into when I was going in through college. I did not want to go to the medical field route and was trying to decide what to do. And ultimately I ended up falling into the healthcare space where I went to a career fair and I had a professor who said, I think it'd be best if you actually went down this route and interviewed with a company that it might be a good fit for you. So did a couple different interviews and ended up in a marketing and sales background role where I did a lot of ride-alongs with the sales team, but then also was doing more of the marketing and working directly with the insurance carriers in the insurance brokerage world. So it was very interesting because what was unique, bringing the thought process from the provider side of what I learned growing up from my parents into the healthcare landscape with the insurance realm. That was unique. And then I've really enhanced that throughout my career, continuing on forward, especially as we start to get to more creative and customization, working directly with hospital systems, separating out different pharmacy benefit managers, working with independent TPAs, third-party administrators. So along my career, it's been so helpful to understand both the provider and the care side and the patient side, and then adding that into what I've known on the insurance side too. And how do we really start to change healthcare from within?
Yes, because you need all of those parts to be able to create true change. So that's a really important part of your background. And then continuing on from that, if you could tell me how your passion for functional medicine started.
Yeah, that's a great question. And functional medicine was always interesting. My mom growing up was always focused on healthy eating, so very much non-processed foods. She would always continue to make meals for us and bake a lot of different things that were healthy, and she always pushed the boundaries what she could. But I actually didn't get very far into it growing up until I had my own health issues. So I had a health scare. So 2023 in September, what ended up happening was my heart went into AFib. So atrial fibrillation for everybody listening out there. What ended up happening, it was beating irregular. And during that time frame, I had worked with doctors both here at Corewell and then also in Cleveland Clinic to understand ultimately where and how I was going to navigate this. Well, I ended up having surgery in January of 24. And through that surgery process and a lot of meetings with the doctors, we talked through the different habits and things that I was doing prior to from a healthy living perspective. What ended up happening was I was eating a lot of sugar, I was eating a lot of processed foods, and this job is a very stressful job because we're navigating both the internal and the externals and a lot of different players and people trying to navigate communications and pull in direct teams. So it's a stressful job. There was also, it's tough because it's a lot of client entertainment. And as fun as that always sounds, it was a lot of different 1 or 2 drinks here or there. And that could be 4 or 5 times a week. So adding all of those things up, that's where I started to realize that I was going down a path that ultimately was affecting my health, and I needed to get my health back on track. And so through having some of these struggles with my own health and my heart, I ended up getting really in depth into functional medicine, started listening to a lot of different podcasts. I know, Erica, you and I have talked about Mark Hyman and some of these others that have been kind of the foundation of functional medicine. And you've taken it really to that next level with some of the employers and then the individuals that you're working with, which is so awesome from what you're doing. But it's been great for me because I've started to cut out a lot of processed foods. I stopped drinking. I'm sleeping much better. I'm focused on navigating stress and anxiety and really pulling myself through this journey, which I didn't ever think that I was going to be part of this journey in my late 20s. Not something that ultimately I was hoping to happen, right? But it's truly changed my overall health. And I think for the future and long term, it's going to be really cool because I'm just so much healthier and I can tell it from my mind and my body and just how I'm able to go about my daily life differently than I was prior. I was much more sluggish and getting to the afternoons. And so a lot of things that I've noticed, which were my brain was foggy in other aspects before, that's just not there anymore. And so it's amazing when you really start focusing on functional medicine and bringing in both the diet, the exercise, the sleep, and all the other behavioral health and mental health habits too that go along with it, where it's changed the trajectory of my life completely.
Awesome. Thank you so much for sharing that story. And I like how you addressed all the components. So it wasn't just one simple thing that you did. You really addressed the multiple facets of your lifestyle. And did you have someone kind of helping you put all that together?
That's a great question. I actually, in the beginning, I really listened to my doctors and the navigation through that, but it was actually mostly my own personal learning and journey along the way. I had a lot more time on my hands because I was ultimately going through this journey and didn't feel like I could relate to anybody. And after the fact, so many amazing people came out and were very open and honest about things that had happened to them and things that had changed their life. So, but during this journey, I ended up focusing on how do I overall start living a healthier lifestyle? And it started with my doctor actually mentioning, because AFib, one of the direct effects of AFib is alcohol. And then that led me down the path of, okay, reading and listening to different podcasts about the effects of alcohol. Well, then the effects of alcohol affect sleep. And then sleep is also affected by the foods that we eat. And so the processed foods, the dyes, the other aspects. And it just really transformed from a journey perspective because I just started to open up my mind and think about, well, what else is out there? What am I not thinking about that people try to hide, or there's always not the truth out there before? Because you think about drug manufacturers, you think about food administration, food manufacturers, there's just not a lot of truth out there. And it's really cool where we've got, similar to what we're doing today, podcasts, there's other great resources, information. There's now app technology too, where Yucca has been a tremendous app for me to start pulling back from all the processed and other additives and being able to realize what's truly healthy, what's truly not. I even have taken that to the next level in the last 6 months where I am outside quite a bit during the summertime, as we all are, because in Michigan, we're trying to enjoy the nice weather, right? But I was putting sunscreen on and not realizing what was in the sunscreen, and that your skin is one of the biggest organs in the body. And so listening to a podcast that talked about that made me rethink that, okay, the sunscreen that I'm putting on my body, ultimately, I need to make sure that that's not affecting me too. And the stuff that I was putting in had a lot of additives, and it was not a healthy sunscreen for me to have. So I started this journey by myself, and I've pulled in a lot of amazing resources. I know you and I have had several great conversations around functional medicine and things that employers are doing and individuals are doing. And you've got a lot of great stories too from some of the companies that you work with that have truly changed people's lives for them to live a healthier lifestyle, to take care of their family, to enjoy their life, whether it's within work or outside of work. So it's amazing when you really step back and start to learn and realize that there is a lot more out there from an education perspective that we often don't think about, but there are direct effects of the things that we eat, the stuff that we put in our body, and how we go about our daily lives, from exercise and lifestyle and even just walking. Sometimes now during the winter, I don't always do that because it is a little bit colder. So I've got a Peloton, but even walking for 30, 45 minutes at night is truly incredible what the values are of that.
You have done such an amazing job navigating all of this and putting all this information together. Probably your background helped a bit with that. But, as you probably know, it's not easy for most people to be able to do this. And so one of the ways that we help kind of even sort through the noise or over information out there, what's actually true, what's good advice, what could work for individuals, is we partner with employers. And so, Max, how do you see the needs in the employer space, and how can root medicine or functional medicine address those needs?
So great question, Erica. And I really love where the landscape of the employer world is going. And more companies are looking at alternative options and saying, okay, how do we really keep our employees healthy? And how do we start to really change and create a healthy living, health strategy, lifestyle for our company? Because overall, we need to make investments back into our people for them to continue to live a healthier lifestyle. And one of those has been the functional medicine aspect. And I know that you and I started on the first company together, that you started from a business perspective, and it's gone tremendously well. There's several individuals that have engaged with the program, and their health has gotten so incredibly better. And I love what you talked about too, from there's the one-on-one coaching, but that it's also dispelling the different myths out there, that there's so much information, and sometimes it's information overload. And you take that information, you're able to really pare it down and focus in on what's going to help, because every individual is different. And I think ultimately that's what employers are trying to understand, is every individual life, every individual story, every individual person is so different, and what's going to work for them is not going to work for their colleague or even somebody in their family too. And so you're getting down to the level of, let's start working with the different comorbidities, and let's start working with individuals and understanding their health and well-being, from the medications they take to the different healthy lifestyle habits, and starting to strip away the different pieces that are not truthful out there. And so people that, I've had this belief for 20 years, and realizing that that's not the truth. And so you're really getting down to the root causes through blood work, through the one-on-one coaching, through navigating. And we're seeing a lot of employers think about what else is out there. How do we engage those employees differently? And what is so fun for me is being part of those conversations, because that creativity is really coming full circle. The navigation of the landscape in the healthcare realm, especially what's happening too from a change perspective at the HHS level, I think that's really going to play into the changes here the next 4 or 5, even up to 10 years, as more people are going to be focused on how do we start to create healthier individuals, because there are so many solutions out there, from cost containment to pharmacy management to third-party administrators and networks and direct contracting with hospital systems and other things. But what we're realizing is that many of these solutions, they're really just a Band-Aid, and they're not truly getting down to the root causes, right, of what individuals are facing on a daily basis. So it's so cool what you're doing because you're able to understand each individual situation and then tailor and navigate those specific solutions and helping them through their healthcare lifestyle or their healthcare journey. And we've got incredible stories. And I'm seeing it from the employer side and having these conversations, but I know that you even see the more in-depth of some of these great stories of coming off certain medications and being able to live a healthier lifestyle. And their mindsets change and they're just more active, whether that's at work or that's at home with their families.
So at Root, we work with both individuals and then employer-sponsored members. And the really cool thing for me about the employer-sponsored members is now you have someone who's never heard of functional medicine or really doesn't have that kind of insight into how different things that you put in and on your body may be affecting your current health today and your long-term health. And the ability to just open people's eyes to a different care model, a different way of thinking, where I think you mentioned, medications as one of the pain points for a lot of companies. I know we find that when we talk to companies that the spend on medications is kind of out of control right now. And in our care model, when we look at the root cause and we focus on nutrition first, lifestyle, stress, sometimes supplementation, taking away the things that are inflaming people and then replacing the things that the body needs to heal. When we use that approach, we are able to actually get people off of these medications, including like the really expensive autoimmune medications. Autoimmune diseases are an inflammatory condition. And so simply addressing the root cause of inflammation, which is often, part of the gut, is the way to initially approach this, as opposed to initially like finding the medication to match the diagnosis. So we've had employer-sponsored members who had no idea what functional medicine was, and they went through our program and they worked with both a doctor and a dietitian to coach them through, going from drinking several pops a day, sometimes smoking, picking up food when they're traveling at a gas station, to completely transforming their nutrition by using the simple root plate method, which we patented because we've been using it for years now. And we know it works and you can do it anywhere. So that's one of the core things that we do. And then we support them. We keep them on track because accountability is huge. And so being completely online, we can continue to follow up with people and keep coaching them through these changes. And then the doctor is there because we understand both how medications can be prescribed and de-prescribed. And so we know when it's appropriate for, hey, it's safe for you to come off of this medication and we can monitor these labs. And so that team of support and nutrition first, and then the doctor with the prescribing knowledge and de-prescribing knowledge is what creates the results. So those are my very, very uplifting case stories when we actually get people off of medication. That is our goal at Root, not to put more on. We actually, at Root, we only really need to prescribe medication like less than 10% of the time because our care model is just so different. So
yeah, and you talked a lot, so I loved everything that you just said. And I know that is truly what's making the difference for a lot of these individuals and the employers too, because you're starting to see spend for those individuals too come down as well as they start to live a healthier lifestyle working with Root. But you brought up a great point, because what I didn't mention about my story, so when I was going through my heart troubles and had surgery and then had a couple tough months after surgery, things started to get better. Through conversations with my doctor and the teams, was I wanted to come off medications completely. My goal was to not be on medications long term. At the time, I was on 4 different medications, and these were some very heavy-hitting medications that ultimately could affect my kidney, could affect my liver, could really start to damage different things within my body. So my goal really was to, how do I start to live that healthier lifestyle so then ultimately I can come off medications? And actually, when I started this process, my doctor was adamant that he goes, you're going to be on medications for the rest of your life. This is something that ultimately you're not going to be able to turn around, and it's going to be something you have to get used to. And I was very adamant through the process, and I started to live a lot of those healthier lifestyle habits. I started to sleep better. I started to eat less processed food. I didn't drink. So all of these different things started to add up. And one after one, they started to pull me off medications about 8 months after surgery. And all the way up until the end of last year in 24, in December, I came off my last medication. And so at this point, it's been where now I'm going forward through this process of just continuing to keep those healthy lifestyle habits from the functional medicine perspective going. And now it's just a monitoring process with the doctor. But through this whole journey, you can do this. And that's what's really cool is I've had my own journey, and I did a lot through my own navigation and information. And I wish I would have learned about Root earlier from the, having some of the conversations that we've had too, to do more blood panels and other things. And we've started to do that, which has been great to jump in full steam in going into Root for myself and trying to get my other family members involved. But you can come off medications safely, and then you can continue to monitor and live that healthy lifestyle past something that's happened in your life or autoimmune disease or some of these other aspects. And so it's amazing when I get to work with employers and truly listen and hear their passion for functional medicine and keeping their employees healthy, and that their employees ultimately, they want to be healthy. There's so many individuals that they just don't know where to start. And I'd love to hear from you, Erica, a little bit too, from some of the conversations that you've had with individuals and their journey of getting started. What does that look like? How did you get them started down the path? And then keep them engaged too, because I think those are two big pieces for employers is they want to hear about how do you engage with them up front and start them down this path, and then keep them engaged throughout their journey as they continue to navigate the functional medicine landscape.
Yeah. So first off, congratulations on getting off of your last medication at the end of the year. And what a great way to start the new year. So, and I love how you described it as a journey, and you didn't just stop all 4 meds at once. You had to continue with changes throughout the year. And that's consistent, with what we find. As far as getting employees started, when we first started B2B or corporate sponsored memberships, it wasn't easy. And I think there was a lot of hesitation. Can I actually do this was probably the number one concern. Or will my employees be able to do this? Is it too expensive, or is it too hard? Or, are they not going to cook? And I think one of the great things about Root is that our dietitians have such diverse backgrounds. They have really worked with people from all walks of life, between being a hospital dietitian in their past and then even working with the Women and Children's Health Center. So they know how to meet people where they're at. And there's actually a podcast episode from our dietitians previously you can check out too. But once they get in and visit with us online, just via their phone, it only takes one visit and they realize how different this experience is going to be. We're not scary. We want to know the whole truth, because if we don't know the truth, we can't help. And it's very non-judgmental at all. We set goals with the member. And so it could be something starting very, very simply, because as we know, even really simple changes can make a big impact. And so that ability to have that consistent relationship, which is sometimes missing in healthcare today, right? Sometimes you bounce around between specialists. Sometimes, you don't see the same doctor. And I think that continuity is really key to success and keeping people engaged, as well as knowing how to coach and meet people where they're at.
Yeah, that is such a truth too, is meeting people where they're at. I think that is such a cool statement, because like we talked about before, every journey is different. Everybody's life is different, and you have to meet them where they're at. And ultimately, that's not what the healthcare system is doing right now. They're not meeting people where they're at. Ultimately, we're taking away more things because that's our short-term cost solution. So what I'm seeing in the employer space is what I call the death spiral. And the death spiral is you've got a lot of these employers that are starting to leave the healthcare pool because of these huge increases from the insurance carriers, whether it's across the country or BUCA carriers. I won't name one or the other on here, but they're all struggling because their loss ratios have gone up. There's so many more frequency of large claims. And then also the healthcare trends too, from a pharmacy perspective, has been 25% or more in the trends year over year over the last 4+ years. And you've got also the medical trend being in that 9 to 12% range too. So you're talking about huge increases just year over year, and it's being passed on to employees. And what I mean by the death spiral is that you've got these insurance carriers that are passing on large increases. Well, the healthier populations of employees are saying, well, we want to take on the risk ultimately and go to an alternative solution and self-fund, and then start adding functional medicine programs and really start to hone in on taking that data, that analytics, and making a difference in their employee population, and adding solutions like Root to really do that and meet employees where they're at. But then you've got this big pool of employers that are struggling because they have some unhealthier employees in the pool. What's not fair is that this pool, as it gets smaller, and a lot of the companies are in there are a lot of the more unhealthy populations, while the loss ratios are only going to get worse and the increases are only going to get worse. And you see the insurance carriers, they're taking away the biologic medications, they're adding biosimilars, they are taking away different aspects from provider care and other things too, or they're making it harder to really navigate the healthcare landscape, or they're adding programs like a musculoskeletal program or diabetes prevention and management program. And these programs are great, but they're not really truly helping and meeting the employees where they need to be met. They're not kind of getting down to those root causes. And so what we're going to continue to see is this spiral where companies are going to get huge increases in this fully insured market landscape because the carriers are not adding in programs like a functional medicine program. I would love to see functional medicine really start to be integrated closely into those fully insured carriers, or just the carriers in general, whether a company is self-funded, level funded, fully insured, because these programs meeting people where they're at are truly making the difference and getting people engaged in a different light and a different landscape. Because we'll see the data and information, and we'll have frequent flyers to the emergency room is always something that we talk a lot about. Is you've got frequent flyers, they're going 7, 8, 9, 10 times throughout the year. And what ends up happening is nobody can catch that or meet that person where they're at. And there's an amazing story that I have from a group we worked with where there was a frequent flyer. This individual had gone almost 30 times in a year to the emergency room. And it finally took where the hospital had actually gone out directly to this person's house and said, hey, we want to be here. We want to help you. And what that individual was doing was they realized in the medications they were being prescribed, they were putting it into a jar and then basically just taking a scoop out of the jar and taking that as they didn't have a pill case. They didn't realize. So they were going to the emergency room because they're having all these other issues. And then they didn't understand how to cook for themselves and so it was amazing because when that hospital system finally did that and reached out to that individual and started working directly with them, that person has not been back to the hospital as frequent since. The last time that I had heard, it went from 30 to almost to 2 visits in a year, which is much more from a normalized perspective. But you think about from the employer's perspective, that's saving a lot of money too, both for the employee, but the employer too. So it's truly incredible the different journeys that people are on and the misinformation that's out there and not meeting people where they're at. And I'd truly love to see the change in the healthcare landscape really start going towards that functional medicine, because it is making a difference overall in the healthcare landscape, both for individuals, but then also for employers and their spend. So this is where in the future, we're really going to need solutions like Root and yourself to start pushing those boundaries and adding value to companies.
What a great story. What this person needed was someone to just put the picture together and figure out what was actually going on and what a difference that made. As we wrap up, how do you think the landscape of employee health benefits will change in the next 5 to 10 years with the rise of functional medicine?
Yeah, with the rise of functional medicine. So I think that everybody talks about AI. So that's the big talking point, and AI is going to be definitely integrated a lot into the employer solutions. We're going to see that more and more. We've seen some benefits of it. We've also seen some aspects where it's disadvantaged some different health insurance carriers. AI will be incredible because what we're seeing is that the data analytics, the tools and the resources are getting so much more in depth. And we're actually able to see on a risk score of 1 to 5 where individuals are falling. And so what we're going to start to really see is functional medicine programs nurse navigation programs, active, proactive outreach programs. They're going to be focused on some of those higher risk individuals and employee populations, because as the data gets better, we're going to understand those 3s, 4s, and 5s. How do we stop a 3 from becoming a 4 and then becoming a 5 in a risk perspective? How do we catch them at a 3 and maybe move them to a 2? They may never be a 1, but how do we start maybe getting ahead of that and working with the individual, meeting them where they're at and starting to navigate the solution? Because we've got so many different point solutions out there. And I think that ultimately it's becoming a little bit of overload for employees, because there's just so much to see and so much to do and so many programs, and it's hard for them to navigate that. So what we're going to see is the analytics piece be tied into the data with the AI and doing more of those active outreaches and meeting those individuals. And we'll see a lot more employers, and we're already seeing it too, doing different. They're starting with the biometric screens, but now they're taking it to the next level. Well, let's do blood work and actually get a true analysis of each individual. And then we take that information, you put it into the data analytics tools, and then you're able to really start to see and understand those 3s, 4s, and 5s from a risk score perspective. But how do you start to create and tailor a healthcare journey for each individual to help them live a healthier lifestyle? It's really cool to see this journey change, and I'm very excited for the future, because I think that we are going to ultimately make some positive changes. But that's not going to be without disruption. That's not going to be without some upset folks along the way. But it's cool from being in the brokerage seat, being between my clients and between the insurance carriers, of starting to understand how do we really change this landscape for the betterment of not just employers, but individuals. We want people to live a healthier lifestyle. So it's very exciting where we're going from a future perspective. And I'm so thrilled that we're able to work together, because you've done some incredible work for some of the clients that we work on together, and only going to continue to do some incredible work for the clients in the future as we really focus on changing that landscape and creating that positive change for the future.
Thank you, Max. It's really a pleasure to be able to work with you, and we feel very lucky to have a resource like you who is also an advocate for functional medicine. So, Max, what is the best way for folks who want to connect with you to reach you?
So that's a great question. I have, since I've been on my journey, one of my goals for 2025 has really been growing my social media presence, and that's really pertaining to LinkedIn. And so I've been posting 3, 4, even 5 times a week about some of the information of the secrets of the insurance industry, some very valuable knowledge, some resources around what employers and employees and people can be doing for their own health. And that's, generally speaking, the easiest way to reach me is through my LinkedIn. So it's my name, Max Rispler, Maxrispler. So there'll only be one of me on there on LinkedIn. But that's the easiest way. And if you have questions, if you want to have a conversation, I always encourage people to reach out through the messaging on LinkedIn. I'm happy to have conversations and talk through my journey, also talk through ultimately maybe some of the changes or things that I'm seeing. And I just really want to be helpful overall. And I'm so thankful that I'm in a position and also at an organization that allows me to be involved in the community, do a lot of amazing work with employers, and also partner with amazing partnerships like yourself and Root to really bring value along the way. So the easiest way, like I said, is to reach me on LinkedIn, and it's just my first name and last name. And that's the best way to reach me.
Yes, and I can confirm your posts are very informative, and I enjoy reading them. So make sure to follow Max on LinkedIn. Thanks so much, Max, for joining me today. It's been super informative and eye-opening for how we can change healthcare when we partner together.
Awesome. Thank you so much, Erica. I really appreciate you having me on your podcast, and all the work that you're doing is incredible. So keep going.
Thanks for tuning in to the Get to the Root podcast. If you found value in today's episode, don't forget to subscribe, share it with someone who might benefit, and leave us a review. For more resources and to connect with us, visit rootfunctionalmedicine.com. Remember, your health journey starts with understanding the root cause. Join us next time.